Well, good afternoon, everyone, and welcome to this session. And I just want to speak by way of introduction of what we hope to achieve this afternoon in looking at improving outcomes in cataract surgery. And if we look at cataract surgery, we're very aware in whatever continent or whatever country we're dealing with, cataract surgery is an incredible fusion of technology, surgical skill and functional recovery that's been recognised by the WHO as one of the most cost-effective means offered to adults in the world today. So over the last decades we've seen an evolution, and that evolution's been very technology-based in terms of surgery. We've moved from intracap to extracap to phaco, and now we have femto laser. We've also seen a significant advance in the technology with intraocular lenses as well as surgical equipment. So we're moving more and more to being better trained surgeons with technically excellent equipment and intraocular lenses. And we're at the point now where when we view the technical aspects of our surgery, we can really offer patients a level of excellence previously unknown. However, the other side of the equation which we want to focus on this afternoon is that at the end of the day, for our patients, having a technically excellent operation with zero complications, a clear cornea and a perfectly positioned intraocular lens, and with 2 diopters of ametropia, we have a very unhappy patient. So this afternoon we're focusing not on the technical aspects of how to improve our surgery and reduce safety. We're looking at the other just as important outcome: how can we improve our refractive results? And in this day and age, cataract surgery now is a refractive procedure. Having a surgery where you have 2 diopters of CIL and sphere corrected with glasses is no longer an acceptable outcome. So we need to be judging the quality of our surgery and the quality of our publications on our uncorrected visual acuity. This sets the bar a lot higher in terms of the percentage of patients that achieve this good outcome. Best corrected visual acuity should really be reserved as a safety monitoring outcome rather than a sign that you're achieving good surgery. So a good refractive outcome begins with a good understanding of the patient's visual goals. Now, no one needs to explain this to refractive surgeons, but sometimes cataract surgeons, we often overlook this as a basic starting point. And this can be at 2 ends of the spectrum. We can be in communities where there is a profound disabling level of blindness at light perception in each eye, and we can creep into that mentality of saying, well, they were so bad to start with, it doesn't really matter what vision they get as long as they're better. I think we need to challenge the ethics of that statement if it is a brake on us aiming to achieve the refractive outcomes we get, even operating on that group of patients. So we need to know what our patients want, what are they expecting, and then most importantly in terms of auditing our practices is, are we aware of the last 500 cataracts we've done, what percentage of our myopes, our hyperopes and our emmetropes that had visually disabling cataract that we operated on, what percentage of those are we getting within half a diopter of our target refraction? Now, if we don't know that statistic, if we don't know where we're starting, then we'll have no idea how to improve. So just as an encouragement, every one of us as practicing cataract surgeons should be auditing our data so that we do know what percentage of patients are getting these refractive outcomes, and that allows us to give our patients informed consent as to if they ask, well, in your hands, doctor, am I likely to need glasses? And so this leads to the basics of any surgery where, if we take the technical aspect out, what we're aiming to have is a satisfied patient. And in its most simplest form, a satisfied patient is one where the outcome we provide exceeds their expectation. And either they can have unrealistic expectations and we provide an excellent outcome and they're unhappy, or we don't provide them with a good outcome and they're equally unhappy. But this is the real key, as we look at improving our refractive results to get an outcome and expectation that is in favour of the patient. So the current limitations of cataract surgery, if we just put it up against corneal refractive surgery, now allowing for the fact that there's different biological wound healing and we're dealing with intraocular lenses, however, the distance correction predictability of modern small incision cataract surgery is half that of corneal excimer laser, both in terms of, and that has impacted astigmatism correction, effective power, and it limits the presbyopia correction. If we're aiming to put implants into the eye that need a certain refractive outcome to work, and we can only guarantee that in less than 50% of patients, then all the talk about high-end lenses and high-end surgery needs to be put on the back, needs to be put on hold until we can get this right. So cataract surgery is good, but we can and we must aim for better results. So what can we do? Well, we need a better understanding of patient outcomes. We need better biometry and better IOL calculations, more accurate and predictable surgery, safer surgery leading to better and more accurate refractive outcomes. So this afternoon's symposium is specifically looking at these skills. What can we do to improve the areas of biometry? What's a good scan? What scans do we need to repeat? What's the current best practice in terms of IOL calculations and formulae? What do we do in those patients who've had previous intraocular surgery or corneal refractive surgery? And then some tips at the end for safer surgery to help give these improve refractive results. So we've got an excellent faculty this afternoon, and we look forward to a practical session so that when we go back into our practices, we'll be armed with better tools and with a better understanding of these areas to improve the refractive outcomes of our patients. So we look forward to a good interactive session together. Thank you.